My name is Dr. Adrian Hayter and I'm a GP and the National Clinical Director for Older People at NHS England. And the NHS is celebrating its 75th birthday on the 5th of July. My dad, who was a doctor, worked for 50 of those years as a doctor in the NHS. He came as an immigrant from Burma in 1961 and he worked in hospitals in London and out of London, but also later settling for a career in general practice. As a GP, he worked with the partners in his practice, serving his community 24 hours a day, 365 days a year. And I grew up in that environment, watching him work and his job not just being a job, but a vocation. He carried with him, at all times, his doctor's bag, which contained all the tools of his trade. And when he eventually retired after 50 years, and I had become a GP, he passed his bag on to me. Unfortunately, it deteriorated with age. The seams started to come apart, and I stopped using it because it was so precious. However, recently, I had the opportunity to have the bag repaired, and the repair shop on BBC took the bag and repaired it and returned it to its original glory. And I'm really proud to have the bag back with all its equipment so that I can use it to help people understand the role of general practice and the community in serving people's health needs. Dad was very much a part of that community, working with many other health professionals, both in community services and in the hospital. But he also connected to voluntary groups and faith organisations, and later years after he had retired, volunteered as well, because he understood that it was not just about the health needs of his patients. It was much wider than that, and supporting their health and their well-being was really important. And I want to pay tribute to all the community services staff who look after people in their communities and close to their homes, and often do that caring in people's homes. Dad unfortunately developed a serious illness last year, and what I saw was that the care that he got was really care which was joined up. The hospital, the general practice and the community services came together to support him and us in understanding his illness, and eventually supporting him to come home, and together with the hospice team in a hospice at home service, supported him to spend his last days at home. I think the future is that more joined up care, but also enabled by technology, which can be supported by professionals who work together across traditional organisational boundaries to deliver really personalised care to individuals and meets their needs. And I'm looking forward to another 75 years of the NHS, where patients can receive that care as close to their home as possible and be given that joined up personalised care approach.